Melonni Dooley. I'm one of the naturopathic physicians at Wisdom Medicine, and we are going to be continuing our conversation about hormones. And you are probably here today because you understand and realize that hormones matter, and you want a better understanding of those hormones so that you can be an effective advocate for your own health care. And you can understand how your body is working at a more comprehensive and holistic way. And so, why are we talking about hormones? As we said, hormones matter. It's because they influence every aspect of our health. Every aspect of a woman's life is touched by a hormone, from regulating our menstrual cycles to regulating our bowel movements. We are affected by these hormones and we feel when they are out of balance. So it's important that we understand what they are doing and how they go awry so that we can be more focused in on our treatments and get the care that we actually need. One of the most complex hormone systems in our endocrine system is the thyroid. And an imbalance in this gland with these hormones is a common source of frustration for many, many women. When you think about the thyroid, I want you to think about it as your metabolic regulator. So it is stimulating metabolism when we need it, and it's suppressing it when we don't. It's like our kind of a gas and a brake pedal. It's modulating these things. When I first learned about the thyroid in naturopathic medical school, when I understood all of the ins and outs of it, it made me think about that image on the back of the dollar bill. Do you guys know this? I found a dollar bill. Do you remember the pyramid on the back? So at the very top is this all-seeing eye. That's how I think about the thyroid. This all-seeing eye on the top of this pyramid, and it is regulating the different body systems. It's monitoring, and it's just stimulate. It's like a little spark. If you need a little more momentum in the digestive tract, oh, it's going to give you a little bit there. If you need a little bit of boost in blood sugar, it's going to give you a little bit there. So it's monitoring all of these systems that make up the base of that pyramid, the largest part of that pyramid. So it is that all-seeing eye. So as a regulator, like I said, it is stimulating processes or it is suppressing and slowing down processes. And we often feel the effects of that, right? And we experience that in different ways. And according to the CDC, 1 out of 8 women will experience a dysfunction or imbalance in their thyroid at some point in their life. Yet the thyroid is often misdiagnosed. So that's what we're going to talk about today is how does this keep happening when so many women are experiencing these symptoms of low or high thyroid function? How do we keep missing it? Because a lot of the women that I see at Wisdom Medicine, they come to me because they know something is wrong with their thyroid and their doctor says everything is fine. So today I want to cover 5 key things every woman should know about their thyroid so that you can be a more effective detective in your own health care and be an advocate for the kind of care that you want. So the first thing that we're going to discuss are the key players. Who's involved here? So what am I talking about? I'm talking about the hormones involved. These are the key players. So a woman goes to her doctor. She's complaining about low energy, weight gain, feeling maybe slightly constipated, feeling maybe bloated. She's maybe even feeling like cold often, like she cannot warm up no matter what she does. No matter how many pairs of socks she puts on, her feet are still cold. And she's also noticed her skin is dry and her hair is changing, and maybe she's losing some of her hair. And maybe she's feeling a little depressed and not herself. And so she goes to her doctor, of course, and she has the feeling that something's going on with her thyroid. And doctor concurs, yes, let's take a look. So they're going to run a test. The most common way that doctors assess thyroid function is with the TSH test. TSH, let's talk about this. Thyroid stimulating hormone, TSH, thyroid stimulating hormone. This is the first point of failure when it comes to properly diagnosing what's going on with you. So the TSH is actually a hormone produced from the pituitary up in the brain. It's stimulating the thyroid. So the pituitary is releasing this hormone, TSH, to stimulate thyroid to release its hormones. So when a doctor runs a TSH test, they are actually indirectly testing thyroid function. They're really looking at the pituitary's function. And they've made this assumption that pituitary function is equivalent to thyroid function. So if the pituitary is pumping out a lot of TSH, thyroid stimulating hormone, that means that the thyroid is low functioning. So they've made that assumption. And unfortunately, that is also the basis of their treatments. So a couple things can happen. Well, actually, let me back up. The other thing about TSH is when you get the lab report, and you may have experienced this, you may have had the TSH tested, and you can see the optimal range on the lab report is usually it states 0.45 to 4.5. That is a huge range for a hormone, huge. So it makes sense that it's often misdiagnosed. The current research on optimal thyroid function says that we are trying to get a TSH of 1 to 2. TSH between 1 and 2 suggests optimal function. So if you've got a range of 0.45 to 4.5, and that's all acceptable as okay, then the next step is your doctor is going to say, it's in that range, the thyroid is fine, there's nothing wrong with your thyroid. So then, so say the TSH is elevated. The doctor will then prescribe thyroid medication, right? And so this medication, usually levothyroxine or Synthroid or some variation of that, will be recommended, and the dosing will be based on that TSH level. So the higher the TSH level, the more thyroid hormone is assumed to be needed. So a couple of things can happen when a woman starts thyroid medication. First thing is it's a wonder drug. It does exactly what was expected. She feels wonderful and amazing on it. It was the right call. Two, she gets the medication. She starts to feel better immediately, but then eventually her symptoms start to come back. And the third outcome that can happen is nothing happens. She takes the medication, she doesn't feel any better, or maybe she feels worse. So that is not a good outcome. The majority of the time, what I see is option number two, or outcome number two, that women are given the thyroid medication, they're doing fine for a while, and then symptoms worsen. They come back and they get worse, and more medication is needed, but that's not fixing the problem. And so they're struggling and they're suffering. And we at Wisdom Medicine do not like to see women suffer. So those are the three options that can happen if thyroid medication is begun based on TSH alone. Now, a more accurate assessment of thyroid function is to look at the actual thyroid hormones coming from the thyroid gland. This includes T4 and T3. Some of you may already be familiar with these hormones. So T4 is inactive thyroid hormone. T3 is active thyroid hormone. The majority of the hormone that the thyroid releases from the gland right here in the neck, right around your voice box, is the inactive form. And that's a beautiful design, brilliantly designed by Mother Nature. Because once the hormone is activated, it is working. So if all of the hormone coming from the thyroid is T3, is activated, then its action is just going to be in the neck, throat, area, it is not going to be able to manage metabolism in the different systems of the body, which is what it's designed to do. So the majority of the hormone that comes from the thyroid is T4. So now you may be thinking, okay, T4 is inactive. How do we activate it? Well, that's a great question. So the majority of that T4 travels down to guess where? The liver. 60% of T4 gets activated to T3 in the liver. That is huge. And no one ever talks about that. So consider if you have liver function issues or liver dysfunction, then you are also going to probably have thyroid dysfunction because the liver is responsible for activating that hormone. So a healthy thyroid function relies on a healthy liver function. This is the second key that you need to be aware of. The liver, as you may know, is a detoxification organ. And so things like toxins, whether they be from the environment or from the foods that you're eating or from an infection that you have and is producing toxic waste products, that is putting a burden on the liver. And if the thyroid cannot be activated because of that burden, you're going to also have thyroid issues. Now, maybe I should back up a bit. You might be thinking, okay, what are my thyroid symptoms? In case you were unaware, thyroid symptoms typically um, include things like low energy, hair loss, cold, like I was explaining earlier, um, constipation, and mood changes, depression if it's low thyroid, maybe more anxiety and irritability if it's hyperthyroid. The liver plays a big role in this because it can help eliminate these toxins, which would improve how you're feeling. But if it is sluggish, then it cannot clear those things, and the thyroid can't be activated to help move those things through the liver, and it's just this vicious cycle. So I said environmental toxins. I'm talking about things like plastics, perfumes, endocrine disrupting compounds that you should all be familiar with. And we'll talk more about that in later in the presentation. So the next thing that you want to be aware of, the third key, is where the rest of T4 goes to be activated. And another big chunk of T4 goes to the digestive tract to be activated to T3. So this is why we get constipated when we don't have good thyroid function. It just slows everything down. This is also affected by our diet. If we're eating things that are irritating to the digestive tract and causing a lot of inflammation, that's going to create things to slow down and to there be more inflammation there and more toxic waste products that are released that the liver then has to deal with that then will slow the thyroid down. So all of these things work together to improve thyroid function and vice versa. The other thing about the digestive system that is important to thyroid health are the microbiome, the microbes in the biome. And if we have any type of candidal overgrowth or other type of bacterial overgrowth or virus that's impacting the microbiome, that is also going to affect the activation of thyroid hormone and create these symptoms that we see. So healthy thyroid function depends on a healthy gut. The fourth point the fourth key point that you need to be aware of is the healthy thyroid function also depends on a healthy adrenal system. Remember, I mentioned that the thyroid is a metabolic regulator. It can stimulate or it can suppress things as needed. Well, the adrenals are a big part of that. They are also involved in upregulating metabolism through cortisol release and adrenaline to get sugar released into the system so that you can have energy, you can function. They also help to calm things down if needed. So they do play a role in regulating metabolism. So if we have been under a great deal of stress for a long period of time, those adrenals can be overworked and we can start to see them being depleted. We can start to see dysfunction. And so the thyroid has to do more work to try and stimulate the adrenals to function. And that depletes the thyroid pretty quickly. And so we often will see low thyroid function in addition to low adrenal function. They often go hand in hand. So at Wisdom Medicine, we often will do a adrenal panel along with the thyroid test to see the whole picture of what's going on. So the very last key point that I want to mention that every woman should be aware of is that emotions play a huge role in the health of our hormone systems. And the thyroid is no exception. So, and the thyroid being placed around the voice box is kind of interesting because the emotion around our voice, whether we feel that we have a voice, whether we feel that it's safe to speak up, uh, if we feel that we can't be our authentic selves, that thyroid can take a hit because of those emotions. That can be enough to suppress thyroid function. And we need to address those things while we address all the other key points I mentioned, addressing the liver, addressing the gut, addressing the adrenals, and addressing our emotions. And I'll just give you an example of a person that I worked with recently who came to see me because she had a diagnosis of Hashimoto's thyroiditis, and she was on medication for that, had been on it for years. I think it was 125 micrograms of Synthroid. And she was starting for the last 18 months, she had been struggling with what she said was an inflamed body. She just felt her whole body was inflamed. And she went back to her primary care physician to try and get help. And again, they did the same testing, found everything was fine. This medication was not changed. It was not her thyroid. But she felt that there was something going on with her immune system, her thyroid, what have you. So, as I was talking to her and getting her history, she shared that the last 18 months have been extremely stressful. This was around the time of COVID. And so she was in lockdown. She was in the media. And so she was used to being around people. And now suddenly she finds herself kind of sequestered away. And that was stressful. She was having some family challenges with young daughter and what her daughter was going through. And then also where she lived, there were a lot of protests going on at the time around Black Lives Matter. And so there was a lot of police activity and helicopters and lots of commotion that just made her feel unsafe in her own home. And so she was dealing with a lot. And as she was talking about these things that were happening in her life, she kept like going like this with her eyes. Now, I should say, I didn't mention, sorry, one of the things that she came to see me for that prompted her to seek out wisdom medicine was she was having a lot of vision problems. And that's why she was also feeling like her autoimmune system had kicked up and she was having a flare of Hashimoto's. She was having very dry eyes and she was having blurry vision. She couldn't see very well. And so as she's talking about her story, and she's closing her eyes like with force, like really, I brought it to her attention. And she said, no, I didn't notice that I was doing that. And so we had a conversation about how that response to her stresses was related to her thyroid and how to address those emotions to help her thyroid and her immune system calm down. So we did a number of intuitive healing sessions all around her emotional well being and the stresses that she'd been under. And within about 3 sessions, she felt so much better. Her eyesight had improved. She didn't have such dryness of the eyes. There still was some work to be done, and we were still working on foundational things like we talked about earlier with the physiology and the biochemistry that affect thyroid, that had kind of gotten off the rails. But it was so impressive to me that her body was responding to these stressors and it was impacting thyroid hormone. So I tell you that story because I want you to think about what in your life is going on that is contributing emotional stress, which then is causing a thyroid imbalance. So, just to recap, the 5 key things that you all need to know and be aware of so that you can be more empowered to take care of your thyroid and get the treatment that you need. First step, first thing, are know the key players. That's TSH, free T3, free T4. Now, if you've never had it tested before, I highly recommend you also check for antibodies to the thyroid just to have a full, complete picture. Make sure that there's no immune interaction that is contributing. So that's always good to do the first time you go get that checked. So TSH, free T3, free T4. Ask for them. If your doctor doesn't feel comfortable doing that because it is not standard of care to run a T3, especially, sometimes they will do the T4, but the T3, not so much. There's many labs out there that are cash pay. You can just walk in and say, I want my T3 tested, and they'll do that for you. The second key thing that we need to be aware of is where this thyroid hormone gets activated and the major systems that are involved. And the first one is the liver. The liver is key to activating the majority of thyroid hormone. The second place it gets activated is in the GI tract. So digestion and your microbiome are very important. The health of those two things, very important to the health of your thyroid. The fourth key point is the adrenal system. A healthy thyroid depends on a healthy adrenal system. So if you are overstressed, overworked, overwhelmed, take some time for yourself. Spend some time in self-care to calm that system down, to nurture that system, to rebuild and restore the adrenals and your stress resiliency. And then the last point, which I think is probably one of the most important from my perspective, is our emotional well-being and how impactful our emotions are on our thyroid and its function. So, the last thing I want to leave you with before I take questions is a few things that you can do today to start taking care of your thyroid, if that is a concern. So, the first thing is that environmental detox, liver support, liver love that you need to give. So, one resource I want to share with you is the Environmental Working Group, ewg.org. They have an excellent database of products that are safe, that are low toxicity, and a lot of education around that. They also have this guide, the Dirty Dozen list of endocrine disruptors. This is a great guide, and you can also go on their website and learn more about endocrine disruptors. But these are mostly in the plastic family. That's where I would start. Is like look around your home. If you have a lot of plastic containers, food containers, if you're drinking out of plastic bottles, I would start eliminating those things and switch over to glass, as it's much safer. Plastics, what happens is they get stuck in the fat, and then the liver can't eliminate them, can't recognize them as toxin, and they really interfere with hormones. So check out the ewg.org website. Look at their endocrine disrupting documents and educate yourself about where these things reside, because thyroid is not the only hormone that they interfere with. The other thing that you can do for your liver today is a lovely home care treatment called castor oil pack. And I love the Queen of Thrones castor oil system. It's all organic, it's less messy, it's easy. She has great resources, and Wisdom Medicine actually has a affiliation with them, so we get a nice discount for our patients because it's a wonderful treatment and it's something so simple you can do at home to stimulate circulation through the liver, which helps clear toxins out, helps improve its function and metabolism. It's just a really lovely, effective, gentle treatment that you can do for yourself. The other thing you can do is start incorporating more liver friendly foods. So these are bitters. The liver loves bitter things, bitter greens, bitter herbs that help to stimulate bile production and bile flow, which again helps with detoxification and metabolism. Now, the other part of detoxification is elimination. So, bowel movements. We got to have good bowel movements, ladies. We cannot be missing a day. We can't go a week without a bowel movement. So, and you might laugh, but I get patients who are like, I had a bowel movement last week. It was fine, normal. So, so just so you know, that's not normal. We need to have a bowel movement every day, and it should feel complete. It should be easy to pass. It should be nice and brown and solid formed. But if you have anything different from that, there's probably a problem that needs to be addressed. So there's many ways to address constipation, and so taking a look at your history and what's going on with you would be the best guide there. But definitely, you can start with just increasing hydration, maybe adding in more plant foods, fiber, and even sometimes a little magnesium might be needed. The other thing that helps with digestion is our foods that we're eating. So making sure that you're eating food for you, not for anybody, but for your body. Your food should nourish your body. It should not harm your body. So we at Wisdom Medicine, we don't follow a particular diet because there is no one size fits all diet plan. We want to work with your body. We want to nourish your body, and that's how you should approach it as well. So, finding the foods that feel good to you, that help you function at your best, that's what you should strive for. Now, if you're wondering where should I start thinking about eliminating certain foods, well, the two main categories of food that seem to be most problematic for thyroid function is dairy and gluten. So you can always start there, eliminate those foods, and just see how you do, see how you feel. And then you can go from there. And then the last thing I want to suggest is, again, if there is an emotional component, if you're under a lot of stress, find a therapist, find some support, find ways to resolve and transmute that emotional charge that sits around your thyroid so that you can calm that down, and it will function much better for you. So thank you so much. I know this was a lot and we went really fast. So I'm happy to take questions if anyone has questions who's on with us live. And I will, Frankie, are you with me still?
Yes, I am. Thank you so much,
Okay,
Dr. Dooley. That was such a wonderful talk. And we do have a couple questions. Um,
excellent.
yes, so you spoke a bit about how the thyroid impacts adrenals and that there's this relationship with the adrenals. What about how the thyroid might show up for people's menstrual cycles? Is there any connection there, even around things like fertility issues that may be linked to thyroid, more on that reproductive hormone side of things?
Hmm. That's a great question. And absolutely, yes. As I said, thyroid is a complex endocrine gland, and it is such because it affects all these different systems, including our female organs, the ovaries and the uterus. It has an effect on estrogen. So, absolutely, it can impact estrogen and progesterone balance if the thyroid is out of balance, or vice versa. If the estrogen and progesterone are out of balance, it can impact the thyroid. It's like a loop, it's a feedback. And so the one affects the other and vice versa. So, definitely, if you suspect or if you have menstrual irregularities, if you're struggling with fertility, and in addition to checking the sex hormones, estrogen, progesterone, I would also include checking thyroid to make sure that that is not what's complicating the situation. Great question. I
Thank you.
hope I answered that.
Yes, that was perfect. And then we have another attendee that asked if TSH is low, does that
Mhm.
indicate low function or hyperfunction?
That is a great question because this is a confusing, and even when I was learning about it, I got confused. So, great question. Thank you for asking that. Low TSH means that you have um, hyperthyroid. So so the TSH is thyroid stimulating hormone. If we don't need to stimulate thyroid hormone, then we will have low TSH. We don't need that signal. So that means that there's a lot of thyroid hormone being produced from the thyroid gland. When TSH is elevated, it's trying to stimulate more and more and more, stimulate that thyroid. And so that means that the thyroid function is low. Now, again, just a reminder, this is an indirect measurement of thyroid function. TSH is not a direct measurement, right? So it's just letting us know, what is the pituitary doing? Is the pituitary trying to wake up the thyroid by increasing TSH? Or is it trying to tamp it down by not giving it any more stimulus, by slowing it down? Now, TSH can be artificially suppressed if we're on too much medication. And I've seen that many times where we have overcompensated with the exogenous hormone that we are consuming through prescription medication like levothyroxine. And we can suppress that feedback loop to the pituitary. And we used to think that was a good thing. Like the lower the TSH, the better for us. But research is showing that that's not entirely true, that there is still that balance that needs to be met. We don't want too low of TSH and we don't want too high because both can cause us problems long term. Great
Great. Thank you so
question.
much for bringing that to our attention too, because I think that that is something that gets lost a lot of times because uh,
Absolutely.
there's more information out there often on low thyroid symptoms, but then how does someone know that they may be experiencing that hyperthyroid side of things as well?
Right. And if you think about thyroid as your metabolic gland and you think, okay, if metabolism is increased, I'm running, right? It's like everything is ramped up and hyperactive. And so women are going to feel more irritable and on edge. Their heart is going to be racing. They'll have these heart palpitations. They might feel anxious all the time. They just can't feel like they can calm down in their own bodies because the thyroid has just ramped up metabolism everywhere. And um, so yeah, that's if you're experiencing those things, definitely get your thyroid checked. Make sure that, and the full thyroid, right? Not just TSH. We want to check the whole thing and see where the dysfunction is exactly. What has gone awry?
Mhm.
Mhm.
I think the last question, and feel free if anybody else has another one that they would like to pop in. Can being on the pill, and I'm guessing here the birth control pill, from 17 to 37, so a good long time, cause thyroid issues? And what is the interaction there?
Mm. So birth control pills, one, they are affecting estrogen, progesterone, right? But they are also depleting certain key nutrients, which can impact liver, digestion, adrenals. And so all of that together can absolutely impact thyroid function. Keep in mind again that just like remember the little image here, the all-seeing eye, okay? The all-seeing eye, that thyroid is monitoring all these different systems. And so if anything is out of balance or being suppressed or managed in a rigid way, the that is going to impact other functions, other systems. And the thyroid's going to pay attention to that and notice that and start to spark in those areas and start to work on trying to correct that. The thyroid was never meant to be the gland that manages everything long term. It's like kindling on a fire. So you get the kindling started, right? It's quick and it lights up real fast, but then what maintains the fire are the logs, the big wood logs. That's what lets the fire go. And that's how the thyroid is designed to work. It sparks activity in these different large systems. It was never meant to be the one to maintain everything. So when we use birth control to artificially affect the menstrual cycle, to affect those hormones, we are definitely changing the signals that are going to the pituitary in the brain and the thyroid in the throat. And so, absolutely, this can be an issue, especially if you've been on birth control for a long period of time, because again, it does deplete a lot of nutrients that we need. Um, Something else I wanted to say about that. Hmm. Sorry, it slipped my mind. Oh, um, so going back to that analogy of the all-seeing eye at the top of the pyramid, right? And the pyramid, the base of it is the largest part, right? So in conventional medicine, they are looking just at thyroid, right? They're doing the TSH and they're treating based on that, treating from top down. Our approach as a naturopathic doctor and working with wisdom medicine, we take a bottom up approach, right? We are trying to strengthen those foundational systems, correct any imbalances there, and then that should correct the thyroid naturally. And that's what I've seen over the last 11 years I've been in practice, that if we address those foundational systems, including menstrual irregularities, PMS, perimenopause, these imbalances in any part of the endocrine system are related to the base of this pyramid, the digestive system, the adrenals, the liver. If we address those foundational systems, then the thyroid naturally corrects itself. Our female hormones naturally come into balance. And I've seen that over and over and over again. So it can be done, it can be corrected. We just have to work with the body and we have to listen to the cues the body is telling us and give it the support that it needs, not just treat a number or treat a condition. We want to address you as a whole person and make the treatments very specific to what you need. Not what, like I said, with the diet, not what every body needs, but what your body needs. And that's how we approach everything. And that's how I hope that you will start thinking about for yourself. Like as you read about different things online, um, or when you search for something on Google, that you then put that information into context of yourself. Okay, I understand this. How does this apply to me? And that's how you start thinking like an naturopathic doctor. Okay.
Wonderful. Well, thank you so much for these wonderful answers and for taking the time to explore this important topic with us today. And we look forward to being back again next month with our next webinar in the hormone series. So please stay tuned for that. We will be doing it again on the second Wednesday of the month and sending out registration links for those as we go. Thank you again so much, Dr. Dooley. We
Oh,
appreciate it. We
thank you. Thank you so much. This has been a pleasure, and I hope that it was helpful to you ladies out there. Um, yeah, stay in touch, and we will continue this conversation.
Wonderful. Have a great
Thank you.
rest of the day, everyone.
Bye, everyone.